Hello class, my name is Nurse Sally. Today we will be looking at a case study involving digoxin. Digoxin is a medication used for heart failure and atrial fibrillation derived from the foxglove plant. Meet Sean Caudill, a 60-year-old African-American male from San Diego. He is single, has no children, works as a cook in a small neighborhood restaurant and has no religious affiliation. He has a prior medical history of mild heart failure, hypertension and type 2 diabetes. He takes amlodipine and hydrochlorothiazide for his hypertension and metformin for his diabetes as prescribed. He has no known drug allergies and does not take any additional vitamins or herbal medications. Today, he presents to his cardiologist, Dr. Richard, for examination following 2 weeks of increasing pedal edema along with excessive fatigue and shortness of breath upon exertion. Our assessment findings show a pulse of 80, normal sinus rhythm, and his 12-lead EKG showed no ST changes or ectopy. Patient's blood pressure is 155/87. His skins are normal with 2+ pitting edema in his lower extremities. He is breathing 24 shallow, but effective breaths a minute and his lung sounds are clear in all fields. He has an oxygen saturation of 95% on room air, which is within normal limits. He is afebrile with a blood sugar of 130, which is within normal limits. The doctor ordered additional testing to evaluate the progression of his heart failure. Results are in and Mr. Caudill's chest X-ray came back with abnormalities. His echocardiogram shows a decreased ejection fraction, and his blood work shows elevated BNP levels. These findings, along with the correlated signs and symptoms, indicate that Mr. Caudill's heart failure is not being managed with his current prescribed medications and has progressed to moderate heart failure. Dr. Richard follows up with Mr. Caudill where he discusses the findings and prescribes digoxin to add to his medication regimen. What is digoxin and why was Mr. Caudill prescribed this? Let's dig in.
My name is Stephen. I'm a botanist and a biochemist. I'm here today to talk to you about digoxin. Digoxin is derived from the leaves of the foxglove plant species Digitalis lanata. The plant was given the scientific name Digitalis due to the flower's thimble-like appearance and how it can be fitted over the fingers. The brand name of digoxin, Lanoxin, is coined from the name of this particular plant species. Digoxin belongs to the class of medicines known as cardiac glycosides. It is interesting to note that digoxin is the only cardiac glycoside available in the United States. Digoxin is classified as pregnancy category C because it is currently not known whether use during pregnancy can cause fetal harm in humans. A fun fact about the foxglove plant is that it was once used as arrow poisons by African tribes and as medicines by the ancient Egyptians and Romans. Digoxin is used to treat mild to moderate heart failure and atrial fibrillation. For heart failure, it is generally a second-line therapy because it only addresses signs and symptoms and does not demonstrate the mortality benefits that other drugs possess. Digoxin works by increasing the force of myocardial contraction by inhibiting sodium, potassium, and adenosine triphosphatase, also known as the sodium-potassium pump. The sodium-potassium pump helps maintain osmotic equilibrium and membrane potential in cells by keeping a higher concentration of sodium outside the cell and a higher concentration of potassium inside the cell. When digoxin inhibits this enzyme, the movement of sodium out of myocardial cells decreases, which drives an influx of calcium into the heart, causing an increase in contractility. By increasing myocardial contraction, digoxin directly increases cardiac output, which alleviates the symptoms of heart failure. Atrial fibrillation often accompanies heart failure because it results from the sympathetic nervous system's response to inadequate circulation caused by heart failure. Digoxin helps treat atrial fibrillation by slowing electrical conduction between the atria and the ventricles of the heart, and by stimulating the vagus nerve, which both ultimately decrease heart rate. The decrease in heart rate along with the increase in cardiac output from increased contractility decreases tachycardia resulting from inadequate circulation. Oral digoxin is mainly absorbed in the first part of the small intestine and it is primarily distributed to the heart and kidneys, but the largest digoxin storage is in the skeletal muscles. It is important to note that adipose tissue is not a storage site for digoxin, so only lean body mass should be used to determine dosing amounts. Digoxin is metabolized via sugar hydrolysis in the stomach and colonic bacteria in the GI tract. It is only minimally metabolized by the liver and it is not significantly affected by first-pass metabolism. Most of digoxin is excreted unchanged from the kidneys. Digoxin is generally prescribed orally. Parenteral administration of digoxin is only used when the need for rapid digitalization is urgent or when the drug cannot be taken orally. Intramuscular injection can lead to severe pain at the injection site, so intravenous administration is preferred. The general recommended dosage for adults is 0.125 to 0.25 mg taken orally once per day. However, dosages of digoxin must be individualized and patients' serum levels must be closely monitored due to the drug's small therapeutic index. Because of the drug's small therapeutic index, all patients are at risk for digoxin toxicity. Early signs of digoxin toxicity are generally GI-related, such as nausea and vomiting, but they can also experience vision changes, such as seeing yellowish-green halos or having double vision. Later signs can be life-threatening and include heart rhythm disturbances such as ventricular dysrhythmias, which can result in sudden cardiac death, and premature ventricular contractions that can be felt as skipped heartbeats by patients. To treat severe toxicity, patients are intravenously given the antidote digoxin in Unfab, also known as Digiband or DGFab. This medication contains digoxin-specific antibodies that come from sheep. These antibodies combine with digoxin to inactivate the drug and prevent it from reaching the tissues. For non-severe digoxin toxicity, other medication options should be explored before utilizing DGFab. Digoxin should never be prescribed for patients with severe myocarditis, second or third degree heart blocks, or ventricular tachycardia or ventricular fibrillation, as it has been shown in studies to worsen myocarditis, and heart blocks and ventricular dysrhythmias are known adverse effects of digoxin. In addition, due to digoxin's small therapeutic index, several conditions require that digoxin be administered with extreme caution. These noted conditions increase patients' risk of developing digoxin toxicity and fatal dysrhythmias. The most common cause of digoxin-induced dysrhythmias being hypokalemia due to diuretic use. Often patients with heart failure are prescribed diuretics to help with water retention or edema that is caused from their heart failure. A side effect of diuretic use is electrolyte imbalance, so these patients must be carefully monitored when being prescribed digoxin. Digoxin interacts with many drugs as indicated on the slide. Careful consideration must be made with drug interactions due to, you guessed it, the drug's narrow therapeutic index. Drugs that increase digoxin serum levels can lead to digoxin toxicity, causing potentially fatal reactions, and drugs that reduce the effectiveness of digoxin can lead to further progression of the patient's heart failure. In addition to other medications, several herbs and dietary supplements interact with digoxin, which either increase and decrease its effects, which will require dosage adjustments. Finally, regarding response to medication, there are health inequities to consider among patients when administering digoxin to patients. Digoxin is not indicated as a first-line therapy for adults over the age of 65. Older adults are more likely to hold higher digoxin serum levels, thus making them more likely to suffer from digoxin toxicity. The increased serum levels are likely due to decreased kidney function in older adults, which impairs excretion, thus leaving more digoxin in the body. Elderly women in particular have a greater risk of accumulating digoxin and having higher serum levels than elderly male patients, thus making them even more likely to have digoxin toxicity. There are no significant differences in response to medication administration, action, or response between different races and ethnicities.
Okay, now that we know everything about digoxin, let's check back in with Mr. Caudle. In response to the medication, physiologically the patient's heart will have improved contractility and pumping ability. The more efficient heart should decrease the patient's blood pressure, as well as decrease the respirations the patient needs to get adequate oxygen flow. Psychologically, the patient appears visibly distressed and upset that he is now going to be prescribed yet another medication. Appears to be aware of his own mortality and afraid. Being a diabetic, the patient is aware that he is at a greater risk of renal impairment and that serum digoxin levels must be managed more closely if he does develop renal impairment, which worries him about the future. In terms of socio-economical response to this new prescription, The patient does not have stable income and lives in an affordable housing community. The patient does not have a spouse or children that can help. The patient does not own a car and relies on public transportation and rides from friends to get around. This makes it difficult for the patient to routinely get to medical appointments to get follow-up appointments or lab work, and to pharmacies to get the prescriptions refilled. All of this creates challenges with medication compliance. The cost of the drug itself will not be a financial burden upon the patient as digoxin is covered by the patient's Medicaid plan. The patient has a long-standing distrust in the medical system due to historical racial inequities of the system towards Black and brown individuals. This also increases the risk of non-compliance with the medication regimen. The patient is not religious. Spirituality does not affect the patient's response. Utilizing all this information, we can develop specific nursing strategies to optimize reliable medication administration. First, the nurse should take a full medical and medication history to ensure the patient has no contraindications and that no drug, herbal, or dietary interactions exist. Additionally, it is imperative to obtain baseline vitals and conduct a physical before administration, so that we do not induce a negative response. The patient's heart rate must be at 60 beats per minute or higher. If not, the dose needs to be withheld and the provider will need to be consulted. Digoxin reduces heart rate and can cause arrhythmia or an abnormal heartbeat. It is very important that digoxin is taken every day at the same time, 1 hour before a meal or 2 hours after a meal. Patients should not take digoxin directly with food so that the absorption of digoxin is not reduced in the digestive tract. When taking digoxin, high potassium foods, fiber, alcohol, and recreational drugs should be avoided to minimize adverse effects. For example, high potassium food can result in hyperkalemia and can lead to heart failure or irregular heartbeat. Patients can be referred to a nutritionist to help develop a heart-healthy diet within these limitations. For Mr. Caudle specifically, we can refer him to a social worker to help reduce obstacles that may make it difficult to maintain therapeutic success with digoxin. This includes transportation challenges that may prevent him from attending necessary follow-up visits, and provide emotional and mental support during this stressful time since he is single with no children. Most importantly, all patients need to be adequately educated on the prescribed medication to include benefits and risks, proper usage, side effects, and drug and supplement interactions. Let's take a look at how we could best educate Mr. Caudle on digoxin. Hello, Mr. Caudle. I see that the doctor has prescribed you digoxin to add to your medication regimen. I wanted to provide you some additional information about your new medication. Here is a brochure that goes in depth about digoxin. As you can see, digoxin has been prescribed to help manage your worsening heart failure. After taking digoxin, you should feel improved energy levels, less shortness of breath along with decreased pedal edema.
Sorry, Nurse Sally, what is pedal edema?
My apologies, Mr. Caudle. Pedal edema is the swelling you have been experiencing in your legs, and digoxin will help reduce that swelling. I want to pay special attention to the section which outlines how to take digoxin. Digoxin has risks of causing toxicity, so following these guidelines are very important. For example, you always want to take every day at the same time, and keeping a journal may help you with this. You also always want to first take your pulse to ensure your heart rate is above 60 before taking digoxin.
What do I do if I forget to take my medication?
If you remember within 6 hours of missing your medication, it is still okay to take. Otherwise, you will need to wait until the following day. It is very important you never take a double dose to make up for a missed dose. If you look at the next page of your brochure, you will see common side effects that you may experience while taking this medication. Most importantly, if you experience 2 or more of these symptoms or any vision changes, you will want to call 911 immediately, as they are signs of severe toxicity that require urgent medical attention. Also, while taking digoxin, you never want to add medications or even over-the-counter medications without consulting your doctor. There are also herbs and foods in your diet that you want to avoid, but you can review this more with the nutritionist we referred you to. Lastly, the brochure includes tips on how to best take your pulse daily prior to taking digoxin. Mr. Caudle, can you show how you would take your pulse?
Yes. Using my middle and index finger, I will feel for my pulse on my inner wrist at the base of my thumb and count how many times I feel a beat for 1 full minute. And if it is less than 60, I won't take digoxin.
Perfect. Great job. Now that the patient has been properly educated on the medication and we can feel confident that we have optimized medication administration, let's look at how we can monitor the drug's effectiveness. Patients will require frequent physical examinations, electrocardiograms, and blood work. Blood work will monitor serum digoxin levels to ensure they are within therapeutic range. Serum potassium levels, as well as other electrolytes such as magnesium and calcium, will also be checked to ensure they are within normal limits to reduce risk of digoxin toxicity, especially when the patient is on diuretics, like in Mr. Caudle's case. In addition, electrocardiograms will ensure the patient has not developed any dysrhythmias. Patients should be monitored for digoxin's therapeutic effects. For example, with Mr. Caudle, we will be assessing for decreased pedal edema, reduced fatigue, and improved breathing. Patients will also need to be monitored for adverse effects and digoxin toxicity such as headache, dizziness, vomiting, as well as more serious adverse effects such as bradycardia, dysrhythmias, and visual impairments. Lastly, let's look at some additional considerations in regards to drug administration. The ANA Code of Ethics for Nurses focuses on respect for human dignity, with the nurse's primary commitment being to the patient. The nurse advocates for the health and safety of the patient and maintains transparent communication while following all legal and professional standards of care. In particular, nurses have a unique role and responsibility in medication administration, in that they are frequently the final person to check to see that the medications are correctly prescribed and dispensed before administration. Ultimately, this means that nurses are responsible for safe and virtuous medication administration. Part of how nurses verify this is by confirming the 5 rights of medications administration, after obtaining an order from the prescribing physician. This includes ensuring the right patient, right drug, right route, right time, and right dose. The nurse also ensures that patients are being educated on the drug they are being prescribed and are given an opportunity to refuse the medication after receiving education regarding the medication, along with any risks and complications of refusing treatment. The FDA, Food and Drug Administration, regulates the manufacture, distribution, advertising, and labeling of drugs, while the DEA, Drug Enforcement Agency, regulates the manufacture and distribution of controlled substances. Digoxin is not a controlled substance, but is administered via prescription only. It is regulated by the FDA following their approval for use since its initial approval for use in 1954.